Good afternoon, everyone. My name is Edwin Luna. I'm the Employer Program Specialist for the Center for Career and Professional Development. My co-host also who runs this is Rosemary Chan, and she might pop in, she might not, but thanks to her, we got the wonderful guest here, Dr. Johnson Ho. I will pronounce that right. He is a CUNY alum at City College, from Macaulay Honors City College. So he'll be here to talk to you guys about a little bit about himself. And, then we'll go afterwards, a little presentation and question and answer at the end. Just be aware, folks, that this session is recorded, but you are not recorded. Only the speaker is recorded. And also as well, this is a very relaxed forum. No question is dumb questions. But again, at the end, we'll take question and answer after everything's all said and done. And without further ado, I will hand it over to Dr. Johnson.
All right. Hello, everyone. My name is Dr. Johnson Ho. I'm currently a PGY 4 Chief Resident Physician of Physical Medicine and Rehabilitation at SUNY Downstate in Brooklyn, New York. And I'll be starting an Interventional Pain Medicine Fellowship at Rutgers Robert Johnson Medical School in New Brunswick, New Jersey in July 1st. To go through some really brief history of my background, I went to Macaulay City College as the biomedical engineering major, did a lot of research in brain stimulation, patented a few things, published a few papers for a technology called transcranial direct current stimulation that's currently in clinical trials for treating depression, fibromyalgia, post-stroke, motor recovery. And after I finished my undergraduate training, I went on to medical school at SUNY Downstate in Brooklyn, where I've spent, I believe, the past 11 years in medical school training and now finishing up my residency training before I move on to fellowship. During medical school, I did a lot of research on traumatic brain injury, from the basic science through the translational and clinical elements. And during residency, I've done a lot of research just clinically with respect to the patients that I take care of. So I prepared a little talk to give an overview of my current specialty of physical medicine and rehabilitation. So we'll have you open up the PowerPoint slides.
I will do so.
And at the end of this, if anyone has any questions, we'll go through them all. All right. So this is just the overview of my field. I'm currently actually both licensed in New York and New Jersey. I am a certified acupuncturist, and I'll be working in New Jersey starting in July. All right. So what is PM&R? Next slide. So physical medicine and rehabilitation is also known as physiatry or rehabilitation medicine. We are primarily doctors of functional ability and quality of life. So we treat all areas of brain, spinal cord, nerves, bones, joints, ligaments, muscles, and tendons. So whereas a lot of other specialties focus on curing, a type of cure for medicine, we focus on maximizing patients' independence in activities of daily living to improve their quality of life. So we are kind of in the mix, and we interact very closely with internal medicine doctors, orthopedic surgeons, and neurologists. So that's where we fit. So what is PM&R? We are rehabilitation medicine. You can keep advancing. Designed to meet each person's specific needs. So each person's therapy is different, but the different things that we take care of include treating basic disease. You can just keep looking forward. Treating basic disease, preventing complications, managing disability, prescribing adaptive tools, teaching different exercises, and each patient is different. So then therefore we gather a lot of information and tailor each thing for each specific patient. You can advance to the next slide. Keep going. All right, so then the areas that we cover include self-care skills. So people, their ability to feed themselves, bathe themselves, dress themselves, toilet, physical care, mobility, from people to stand up, walk, climb stairs, and very holistic in our management. So we look at their respiration, their ability to talk, their ability to think and process things, their ability to socialize, work-related things we take care of. We are heavily trained in pain management things because we want people to be able to optimize their therapy with the least amount of pain as possible. And we talk to families and we provide a lot of education. Next slide. So we, among the tools in our toolbox, we have medications, we have a bunch of physical modalities, often through physical therapy. We teach a lot of therapies, and we have a bunch of assistive devices and adaptive equipment that we can give. And on the procedural side, so we do a lot of injections for the shoulders, the knees, and the upper and lower back as needed, using fluoroscopy, which is a type of X-ray device, or ultrasound machines. So we can skip this slide, but basically it's a definition between what is an impairment, disability, and handicap. So physiatrists, we are very team-based. We work very closely with physical therapists, occupational therapists, speech language pathologists, nurses, social workers, different vendors, prosthetists, orthotists. So then we're the medical doctor that kind of is a quarterback spearheading all these things. So I work with all these people regularly, and if you're interested in the medical field, there's a wide assortment of options to go through besides just being a doctor. So what does it take to become where I am as a physiatrist? There's usually 4 years of college, undergraduate degree, followed by 4 years of a medical school degree, followed by 4 years of post-medical school training, which for my field of physical medicine and rehabilitation is 1 year of a transitional year, be surgical or internal medicine, and 3 years of specialty-specific rehabilitation medicine. And after that, people have the option of choosing a fellowship, for which my choice has been for pain medicine. Next slide. Within physical medicine and rehabilitation, there are a lot of options. So people can focus on brain injury, like the traumatic brain injury research I did previously, hospice and palliative care, which are for people at the end of life, and you focus on optimizing and having them have a quality, dignified end. Neuromuscular medicine for people with weakness or problems with their movements. Pain medicine, which is pediatric rehabilitation, which takes care of kids and any type of functional deficits that they have. Spinal cord injury for people who have fallen or are in motorcycle accidents with injury to the spinal cord. Sports medicine, which is a very common fellowship choice of residents, which will go over some of the themes that we cover, at least in my residency here. And other things that people choose include cancer rehab, multiple sclerosis, neuro rehab, stroke, and other things. So the conditions that we treat: people with amputations, people with brain injury, cancer, cerebral palsy, problems with swallowing, muscular problems, osteoarthritis, Parkinson's disease, spasticity, movement things, spinal cord, sports, the whole gamut. From pediatrics through geriatrics, we take care of them. So specifically, we treat patients of all ages. We focus on their function, and we have broad medical knowledge base to manage most of the complaints that come to our clinic. And we try to figure out what is the etiology from which their issue is coming from, and we basically mobilize all that medicine has to address that issue. So we're very team-based. We work very closely with all of the physicians and many other allied health professionals. In terms of practice settings, mainly divided into two, but even three. So there's the inpatient side of things where people are more medically or surgically acute, and with oftentimes other medical comorbidities to take care of. And so we work very collaboratively with a lot of people in that setting, versus outpatient physiatrists, where it's more focused with a specific complaint that someone has that we address. And there's also subacute rehab for people who are in like nursing homes, that we also take care of and address. So among the battery of options that we have, that we are trained in at the residency level, include EMG or nerve conduction studies, which is a whole talk in itself. But that we look at the health and function of the nerves and how they connect to the muscles, and it's a type of electrodiagnostic medicine. We do a lot of ultrasound-guided procedures, fluoroscopy-guided procedures, and all over the body, but primarily areas of the spine, the shoulders, knees are the most common, including the hands, wrists, feet as well. And this is just an example listing of all the things that we can do. So we are primarily non-surgical in our approach, and we have surgical colleagues to manage that more invasive side of things. So prosthetic orthotics like bracing or providing prosthetic arms or prosthetic legs for people, electrical stimulation for people who have had physical therapy. You may have experienced like a TENS device where they apply electricity to the muscles to help with your ability, pain sensations. Active physical therapy, manual therapy, joint and trigger point injections. We prescribe medicines. We use alternative medicine as needed, for example, acupuncture, and we prescribe assistive devices as well. So what is a typical workday? In the example of an inpatient, it's typically 8 to 5. We round on patients in the morning. We see whatever issues come up. We manage medications. We observe patients while they receive their therapies in the gym. Usually they receive 3 hours of physical therapy a day, 5 days a week, or 4 to 5 days a week. And we regularly participate in meetings and rounds to optimize care for all the patients we take care of. On the outpatient side of things, again, it's more focused, also typically 8 to 5. Different areas of general rehabilitation, sports medicine, nerve conduction with electromyographies, interventional pain, wheelchair, prosthetic clinics, and all typically focus on a specific point. So then if you have spasticity, we can inject Botox. If you have pain in specific areas, we can give you injections. We can do nerve blocks. We can put trigger points injections in the muscles, and we use guidance. In terms of what training looks like, at least in my residency, we oftentimes have different workshops for residents and medical students and even people in the ultrasound program here that we welcome to join us. So we regularly practice ultrasound on all the musculoskeletal nervous system along the body. We regularly practice EMGs on one another, as well as, of course, for us to graduate residency, we need to have performed and observed at least 200 of them to be certified and able to use this in the future. Prosthetic orthotics. So on the left there is an example of the lab that we work in. So we work with prosthetic orthotists to evaluate them in the medical clinic, and then the prosthetist will bring them to their clinic, measure them, cast them, build basically a model of their foot, and then create a prosthesis that's usually custom fit to each patient. And then on the right is an example of the fluoroscopy X-ray machine that we use when we're performing procedures on the spine. We do workshops on Botox, on patients, not on one another, and oftentimes also on various robots that people have provided for us. And then on the right is an example of the ultrasound machine of the shoulder that we regularly use for diagnostic purposes and to provide interventional procedures. We mentioned sports. So by literature, about 80% of graduates from a PM&R residency will go into a pain or sports related fellowship. So at least in my program, we accept 2 sports fellows per year, and therefore we cover all these different teams. So college football, high school football across New York City. We do Special Olympics and other things as well. We mentioned acupuncture and alternative medicine. At SUNY Downstate, there is a medical acupuncture program for physicians to be certified, and therefore allow us to practice acupuncture. We are also very involved in research and lifelong learning, and residents, we always welcome having medical students or even undergraduates joining us on the research projects. And on the right is a picture of an example of a poster presentation that my colleague and I won first place on at a conference. So this is these slides are a history of where the graduates from my program go after graduation. So as you see, a lot of them oftentimes go into pain medicine, and they go to places SUNY Upstate, George Washington, Yale, Case Western, Robert Wood Johnson, where I'll be going to Pennsylvania. Next slide. Berk for traumatic brain injury, other sports and spine pain medicine things across the United States. Next slide. And here's just some more examples. All right. And that's the end of this talk. So if anyone has any questions, I also have my contact information at the bottom of this, that if anyone has any questions, you guys can always reach out to me.
So folks, it's time for question and answer. If you like, you can write it on the chat, or if you want to, you can raise your hand. I can do vice versa. So, folks, this is your time to ask questions. No question is a dumb question. Want to make that clear. So please ask as many questions as possible. Oh, there's one. What made you choose SUNY Downstate for medical school?
Great. So I great question. When I applied, I was actually choosing between two institutions, and one put me on the waiting list, and the other one, and SUNY Downstate had accepted me. I didn't want to wait anymore, so I chose SUNY Downstate. That's the quick and dirty answer.
Nice.
But also other elements where SUNY Downstate had a lot of neuroscience related research, which was what I was doing before. So I saw a lot of potential mentors that I could work with.
Here's another one. Even though I'm majoring in forensic science, can I still somewhat get on the medical track?
Yeah. To enter medical school, you can study any major you want, even humanities. And as long as you've completed the pre-medical coursework, which there's a specific list, and I'm sure there's a guidance counselor that can assist you with that process, and have decent grades, you can apply for medical school.
How did you study for the MCAT?
I used a program, I believe it was Kaplan, and I looked at all the videos. I did a bunch of practice questions, and this was in college when I was a third year and doing all the other things like volleyball and volunteer medical squad. And so while I would be on call as a volunteer EMT, I would be on the computer kind of studying and doing questions and falling asleep. And then I took the MCATs, and that was that phase.
Cool. This is a good one. Did you enter medical school having an idea of what specialty you wanted to go to?
Not at all. I had no idea what physical medicine was before entering medical school. I barely had an idea when I graduated. So then right now, physical medicine is a really hot choice among medical students, and people are learning it more and more earlier on and choosing their career path earlier on.
There's one. How many medical schools did you apply to in total?
I don't recall. I heard someone recently saying they applied to 30 medical schools, and then people were like, that's a lot of medical schools. I don't recall. Maybe 10 to 15, but it's been a few years.
I think at that point you just see it as a blur.
Yeah, I had a few interviews, and then I boiled it down to two options, and I went with this one.
Cool. Here's one. Looking back from where you are now, is there anything you wish you know before, or wish you could go back and change or / do over?
Personally, I am very satisfied with my entire career trajectory. I think I've been very fortunate to have a lot of mentors and supportive people along the way who have guided me a lot. And even now, constantly we're surrounded by a lot of people who are here to help. And you guys, I see, have this help as well. So take advantage of them.
Good one. Thank you for shouting that out. Here's a question, but I don't think this might apply now. See how we word this. If you weren't in physical therapy, what else would you have specialized in? Don't think you were in
Can you repeat that one more time?
If you weren't in physical therapy, what else would you have specialized in?
Okay. So there's a difference between my specialty of physical medicine and rehabilitation, which is as a physician, and then there are people who specifically study physical therapy or occupational therapy or speech language pathology. So if I did not choose physical medicine, before, actually, a lot of my medical school colleagues all went into surgical specialties. And so I was considering that as an option. I even considered mental health, like psychiatry, as an option. However, after really reflecting and considering everything and considering my entire background and patient populations I want to take care of and what I want to do in the future, physical therapy was something that blended and took the most of all of my education and put it into one field. So that's why I'm happy with my field currently, but I did consider other things, of course, along the way.
Oh, here's a good one. Did you ever feel discouraged regarding the medical school process, and what helped you overcome that discouragement?
That's a great question. I believe, I remember one of my medical school essays was something about adversity and how you overcome it, and that's very relevant because medical school is not an easy process. I am 11 years post-graduating from college, and my most difficult years were during those medical school years. And I, as far as I understand, most physicians will never want to repeat that process again. So there's a lot of adversity that goes into medical training. A lot of people come out having to, seek help and learn more about themselves along the way. But how did I overcome? I definitely went through difficulties in medical school as well. And when you need help, it's okay to ask for help. Like, sure, I graduated valedictorian. Sure, I got a lot of national scholarships when I was an undergraduate, but then I still struggled in medical school. And by that struggle, people recognized that I needed help. People gave me the time that I needed during training. People connected me with the right resources to support me, whether that be like, talking with a tutor and getting study aids, right? Or like talking to people just to talk and debrief everything, or to work on various things. There are resources that abound, especially when you're in training. So definitely use them because they're there for you.
What is the difference between residency and fellowship?
Great question. So for after medical school, you receive a degree as a medical doctor. But that does not mean you have a physician's license yet. To receive a physician license, if you're graduated from a U.S. medical school, you have to have practiced at least 1 year of residency before you're eligible to get a state license. If you graduate from any medical school outside, you need at least 3 years of residency training before you qualify for a state license. However, residency is practical medical training, where you are a responsible physician working in a hospital or outpatient setting and getting the hands-on skills of becoming a physician in that specific specialty. After you graduate residency, then you will become eligible to take a board certification exam in that specific specialty. So for example, mine will be for physical medicine and rehabilitation. However, within this overall umbrella of a medical specialty, there are sub-specializations, which one of the slides I discussed has, right? So for example, of mine, there's pain medicine, sports medicine, brain injury, cancer rehabilitation. So that's a subset within the overall specialty that you extra focus on and trained for my specialty an extra 1 to 2 years on to be uber specialized in that area. And then that itself also has an additional board certification as well that you would take an exam for.
It's expensive.
Yeah.
Did you shadow doctors before applying for med school?
They definitely recommend it. If you have connections, I would definitely recommend getting all that exposure. For me, in undergraduate, my clinical exposure was primarily as an emergency medical technician, volunteering on campus. But I was an engineer in college, and I considered medicine, but it was not my top consideration, right? But as I talked about mentors, right? I had an epidemiology professor as a first year undergraduate who kind of pinpointed me and said, who was also a professor in the medical school. And he said, hey, I want you to take my, clinical medical school classes, just to sit in on them and participate and get your taste buds and your feet wet, right? So that was actually, I think, my first clinical medicine exposure. And then afterwards, he was like, hey, I want you to sit in the neuroscience class with all the other medical students. I want you to do X, Y, Z, right? And then for me, I was just enjoying the learning process. So did I specifically go out to like an urgent care facility to do this stuff? Not necessarily. I kind of took the learning experiences on my campus and made the most of them.
How can you find the opportunity to shadow a physician?
As long as you have interest, people are more than happy and willing to help. So you can literally find anyone, anywhere, reach out to them in any specific avenues that they have, and share with them who you are, share with them what you're interested in, what you want to gain or learn. And people, at least in my field, love to help. So you do not need to be worried or anxious or afraid of reaching out to someone who's all high and mighty, because no, we, especially in the medical field where it's a healthcare profession, we love to help.
I just want to probably even more clarify this more better than I would. What do you do in undergrad to gain clinical hours? I'm currently working as a CNA, but is this considered volunteer hours if I'm being paid?
So no. So if you're being paid, that means it's a work job. So then you would put it on your resume under work experience, not as a volunteer experience. And you literally say, you're a CNA, you work at this institution, you work for these dates, and then these are your responsibilities and what you gain and learn, and how that can translate to your future job that you're applying for.
Do you mentor any students yourself?
All the time. I constantly have medical students, undergraduate students with me. Even parents reach out to me to bring high school students along with me, and yeah, I show them what I do. I'm very diligent and thorough in my work, and I like to verbalize what I do for the patients as well as for the people with me. So I really enjoy teaching and giving people exposure along the way.
To follow up with that question, that was the CNA question.
Mm-hmm.
The person who's asking is, do you need to record the hours of shadowing, or do you record volunteer hours?
That depends on whichever program or certification you're looking for. So that question I would ask to whichever administrator or responsible authority is there, and they'll guide you in terms of how and what to record and who needs to sign off on what. If it's just for yourself to put on your resume, just log it somewhere on an Excel file or a Google Drive thing, and just put it in there so that you have your own record running.
I actually have a question.
Yeah.
I hear this a lot.
Yeah.
But I want to debunk if this is true or not. I've heard from folks that not only medical school itself being grueling, is getting a placement for residency is just as monumentally more grueling than it is medical school. I'm like,
yeah,
I feel like they both work in tandem, but I wanted to get your take on it.
Yeah, great question. So I discussed with you how my medical training was not easy, right? Especially the first 1 to 2 years. No one likes that. However, the good news is that over the past 10 years since I started training, a lot of the medical curriculum has changed, and for the better of students, and also for better outcome of doctors, and for better health and wellness and mental health. And what I mean is because MCAT has a graded score. In the past, to get a medical license, you need to take 3 steps of board exams, and the first one had a grade and was highly weighted on your ability to get into residency. That has now changed sometime in the past X amount of years. I don't recall exactly when, but they made it a pass-fail system such that medical students don't stress out as much about that one exam, and that when they're applying for residency, it's a more holistic view that people consider when they're considering residency. So therefore, when I see the quality of medical students now, so for example, for me, when I was going through medical training, I was on the cusp between the old and the new curriculum. Oh. So back when it was like basic science for the first 2 years and then clinical exposure for the next 2 years, now it's everything integrated in the first year and a half. And then they throw you into clinics like within a year and a half. And then people come out very strong with their clinical reasoning, with their ability to perform assessment plans. And I talk to medical schools all the time, and they're so strong.
That's good to hear, because I've heard, I'm like, hold on, can it get harder than this? I mean, this.
Yeah. So then that's the plus side. But then the negative side as well is because there's an X amount of people that get into medical schools, and then therefore an X amount of medical graduates, and then there's a Y amount of residency positions, right? So therefore there is that difference where people end up going unmatched to a residency program, and that's very highly stressful. And I know people who have unmatched and then matched afterwards and gone to programs, or people that pivoted in other ways, or people that have tried multiple times and didn't work out and therefore had to change their career direction. So all that has happened. So therefore, it's not easy training, but you have to really count the cost and consider things before moving on that step.
Good to know. Someone asked, is the exam a practical exam or a written exam with multiple choice questions?
Excuse me, someone's talking about that. Yes. Sorry, I'm in a meeting. Sorry. Thank you. So MCAT is, as far as I can recall, is an online multiple choice exam. Step one, also an online multiple choice exam. Step two, there are two parts. One is a written multiple choice exam, and then there's a practical clinical skills exam that you have to go in and see a standardized patient for and talk and ask questions and come up with diagnoses and talk to them as if they're a real patient.
Question, from my sense. So what if someone really doesn't get a placement for residency? Is it gloom or doom, or can they retry? Is this a one-shot thing?
Yeah. So different things, right? So
does it vary from specialty?
Each specialty does have their own level of competitiveness, of course. But for applying to residency, if you don't match immediately, right? And then you'll get a letter like a week before saying, sorry, you did not match. And then the good news is that there's what's called a scramble, right? Where there's X amount of residency slots that have not been filled, and then there's all these medical students that have not matched. And therefore, it's kind of like a free-for-all, where like you have to talk to all of your professors, all of your counselors, all of your deans, find out what are all the available positions, and apply to all of them. And hopefully you get an interview, and hopefully you get a spot. Stressful process, but there is that backup. People sometimes end up in the same specialty, sometimes they end up in a completely different specialty, but there is that option. And hopefully a lot of people do match in that process. But of course, there are other people who don't, and then if that's the case, then they basically reapply next year.
Okay. Can someone do it outside of the country? I know there's a but someone can do it outside of the country, or is there a special...
For residency?
Yeah, for residency. Can they say, okay, well, I want to go to Europe? They have some... Oh, you can, okay.
You can. However, that means that you'll only be able to practice in Europe, right? Yeah. If you want to become a practicing physician in the United States, you need to have graduated from a U.S. medical residency.
Okay. Mm-hmm. Interesting. I learned a lot myself.
Yeah.
Any other questions, folks? Concerns?
I'm impressed that people are asking like all these residency related questions at the end.
I was curious too as well, because I'm hearing so many different things. It really clarifies a lot.
Of course.
What if you got matched with a specialty that is different from the original one for residency?
Well, that's fine. Congratulations, you got matched. And then, I mean, when they're, thank you, I'll grab it. Thank you. I mean, when you're talking to a residency program director who has an unfilled slot and is looking for a candidate, they don't just look for anybody, right? They want to look for someone who is trained, is going to fit well with the program and wants to learn, and also vibe well with all the other residents that they're taking in. So, also like people apply for surgical residency and then they end up matching to internal medicine. It's okay. As long as you get into residency, ultimately that's what matters. Hopefully you get what you want, but then, I mean, ultimately for most people, everything kind of works out at the end.
Awesome. Great questions.
Yeah.
Winding down, folks, any questions, concerns? I know since you... Oh, go ahead, I'm sorry.
No. I was just going to share about, talk a quick thing about the contact information on the slides if people want to follow up at some point.
Okay, cool. Here. So does that mean you can only practice the medicine, the specialty that you had in residency? That's a good question.
Good question. Yes and no. Primarily, when you're actually practicing, you primarily want to focus on what you learn and what you're trained in. And you don't I trained in physical medicine. I did not train on heart surgery, right? I do not want to do heart surgery on a patient if I'm not trained in it, right? So yes, you can, kind of like you see how physical medicine touches with internal medicine, orthopedics, and neurology, right? So within those areas that I am abutting, right, that is within my training, right, I can touch on and do and prescribe accordingly. But then, or like even on the inpatient side, when I'm completely in charge of a patient's entire care, I can prescribe everything, right? Because I'm the main physician. However, if I'm on an outpatient basis, right, and I'm seeing someone for pain medicine, I'm not going to do something that's completely outside my training because that's not what I was just trained on, and that would not be safe.
And I do agree, and I like that you touched that base on, applying for medical school. Folks get caught on, I have to major in sciences. You're looking for a well-rounded person. I had a good friend of mine who went from getting a degree in English, ended up wanting to do physical therapy, wanted more, was doing physician assistant. And then when he got to the pinnacle of pretty much of practicum, he's like, well, I think I want to be a doctor. I want more. So he took an unorthodox journey, but as long as you want it and it's something that really incites you, definitely go for it. And again, that tradition of thinking of, I have to have a degree in sciences, not the case anymore.
Yeah. Through my training,
well-rounded.
People from all over, right? People who have worked 10, 20 years in finance and says, no, like I'm done with math and numbers. I want to do medicine. And then they do medical training, right? And then even medical schools, like some have specific, like we want more humanities students, right? There's a medical school made for engineering students, right? So different things exist. And as long as you fulfill the requirements, you can study anything you want and still apply.
Right, here's one kind of last question. Is it common for doctors who have already gone through residency to change their specialty? Oh.
Yes, actually. So I do have colleagues that she graduated medical school, did 2 years of surgical residency and was like, this is not what I want, right? I like acuity of medicine. I like good procedures, but I don't want the lifestyle of a surgeon. Mm-hmm. So therefore, she changed to emergency medicine, and now she loves it. So yeah, people can change. And I mean, you have that training under your belt that goes on your resume and your lifelong training, and then you therefore do a separate residency. And actually, other residencies, they would love if somebody had that training anyways, because you're so skilled already. So therefore, it's totally okay to change your specialty while you're in training. And then the more you learn, the more valuable you are to any program and any patient in the future anyways.
Great questions, folks. Since we're winding down, any last thoughts, any questions? Now's the time. This was very fruitful.
Yeah.
Thank you. Very fruitful conversation. I learned a lot too as well. Bless your heart.
Yeah.
It is and I hear folks that used to work at admission say, I don't want to be a doctor. I'm like, it's a love.
Yeah.
It's a love, commitment, and constantly you're challenging yourself and you're learning.
Yeah, but I mean, on that point of that slide, in terms of all the different other allied health professionals that I work with, when I was an undergraduate, I actually did not have too much knowledge of those options. So then when I'm in training, I'm seeing all these other students in those other, programs. And I'm like, how did you learn about this before, right? And they go to things like this or things, and then they learn about it, and then figure out, oh yeah, this is what fits me most, and so they go for it. So yeah, take a look at those slides again. Consider there are many options within the medical field if you want to enter a helping profession.
Okay. And with that said, actually, I'm going to put my email in the chat for folks who are interested. If you want to get the slide, I have it. Just shoot me an email. It's in the chat. So please, I made an error on my email. Oops, sorry. Let me correct that real quick. And you have the recording of this meeting. Folks, just to let you know, the recording of this meeting will be placed in our career chats webpage. So if you go to John Jay main webpage, you type in career chats, give it a couple of weeks. That's when we post all our videos of all our career chats. So just don't only see this wonderful one. They're all tailored to different careers, different options. So I hope you're aware of that. But just type in the search John Jay career chats on main John Jay page, and it'll lead you right there to the first link. Thank you, Rosemary. Actually, she posted it right there. So with that said, I want to thank Dr. Johnson Ho on giving your time, especially you're a busy man. So definitely want to give a round of applause for our good friend here. Definitely appreciate today. It was very insightful, very learning. And with that said, folks, thank you all for coming and attending.